Welcome to the Revere Veterans Community Show. Today we do have a community veteran and a community volunteer. Her name is Ming Sun. She's been with Mass General Hospital for 13 years. And welcome to the show, Mrs. Sun.
Thank you, Maurice.
Okay, please go ahead and explain exactly what you do.
Thank you. It's an honor to be here today and to talk some of my work with Mass General Community Health Associates and with Mass General Center for Community Improvement. And I work with all the healthcare centers in Revere, Chelsea, Charlestown, Everett, in this area. So my role is a health educator. So what that means is that I develop and manage health education programs for our communities based on needs from patients and clinicians and all the others. So one of the programs I think I would like to highlight today is called A.R.C.H.
And what does that stand for?
Well, A.R.C.H. stands for Access to Resources for Community Health. It's a health education program through information outreach that we established at MGH Community Health Associates 13 years ago. And the program from the very beginning serves clinicians at Mass General, community healthcare centers, patients, and other residents in the communities in their needs for high-quality health education information online and offline. By online, I mean that we have an A.R.C.H. website, which I will share the website address information later in the show, and also offline. Offline meaning people can call me, email me for printed health education materials like brochures, handbooks for their health concerns.
Mrs. Sun, could they also call you on the telephone too as well?
Yes, they can definitely call me on the telephone. Shall I give my number now?
Please do.
Yeah. My number is 781-485-6477.
Very good. Now, what is exactly your role at MGH? I mean, you are a health educator. Tell us a little about that.
Yes. Like I just said, I develop health education programs based on needs, what doctors, nurses tell me they need, and also community needs. For example, one of my programs serves school children. So it's after school, healthy living, healthy eating, exercise, stress reduction program for young girls at 7 schools recently, covering Revere, Chelsea, and Charlestown. And then, of course, the A.R.C.H. program that I brought with me today serves also all these communities to people of all ages.
When you say communities, could you tell us which the communities are, Mrs. Sun?
The communities we serve include Revere here, Chelsea, which is right over the border, and then Charlestown and Everett.
Oh, what about Malden and Lynn? No? East Boston?
We can work with all the people around us, but then because each of these communities that I just mentioned has an MGH-operated community health care center.
Right.
But the A.R.C.H. program that I brought today actually serves all. If people have internet connection, they can log on to the A.R.C.H. website. The website is actually at www.arch-mgh.org. So people can log on to this website if they have an internet computer, and then they can access health education information that we selected for them.
Right.
So the website does not need any sign-up password, so it's for all. Even people outside this country can also access it.
So you're on like YouTube and Facebook and those?
We are not on YouTube and Facebook yet, but we can put it on Facebook and YouTube.
And that would get all over the world.
Yes.
I'd like to ask you a question.
Yes, please.
You've come to our senior center, and we are the elderly people. How do you find them when you first get there together with them?
I find that senior citizens, they are probably one of the most vulnerable populations in the communities. They do need extra care and support based on their age and also the conditions, specific conditions they face every day. That's actually the reason that I met with Lois Diamond at Revere Elderly Affairs,
Right.
or we call it also Revere Senior Center, I guess.
Right.
So I met her back in 2005, I think, and then it was a perfect match because Lois had been teaching a 5-week basic computer skill course for the seniors there. So when I met her, I said I would like to have seniors to know about the A.R.C.H services and especially the A.R.C.H website. So they learn to utilize the website for health information on health, wellness, diseases, conditions, medications, procedures, and a lot of other things they want to know about. So, and then from that time on, Lois and I have been teaming up in teaching this course. So every 5th week during her class, I would come to Revere Senior Center and introduce the A.R.C.H website to her students who are all senior citizens,
Right.
and then show the A.R.C.H website, highlight some special features for them to log on just for hands-on practice so they learn to use it, and they can also definitely use it at home. And I'm always behind what I do, so I share my contact information with the seniors. After they leave the class, they can always call me or visit me in my office because
Would you
my
give them that
office-
telephone number one more time?
Yes,
Mrs. Sun, please?
my telephone number is 781-485-6477.
By the way, I got to thank you as being part of the Senior Center. MGH donated computers thanks to you, I believe. They gave us a whole stack of computers for the seniors. How did that all get started, if I may ask?
Yes, that's actually based on all these years of good work that Lois has put into the senior service through her computer class. So we had been doing this work for several years. Then a grant opportunity came down from the National Library of Medicine, New England region. So we applied for the grant through our partnership with MGH Treadwell Library. So you can see a lot of people are involved in
Right.
putting this together. So we wrote the grant proposal and submitted to the National Library of Medicine, New England region, and we were funded. So that's how we were able to support Revere Senior Center with 5 brand new computers. So for a while, I guess the seniors have the best computers in town.
I got to tell you, it works out fine because
Yes.
Mrs. Diamond has a backlog, and I do mean a backlog of people waiting to get onto those 5 computers.
Yes.
So let me thank you again for what the work you did for
Oh,
us.
thank you. It's my honor to be able to work with Lois and her senior citizens that they serve because she's the one who is doing all the hard work because she organizes the classes.
Oh, yep.
She does the teaching. And for me, I just come in the 5th week and then introduce the A.R.C.H website for all the seniors to be able to benefit from. I must say that it's really, really important that senior citizens take advantage of the high-tech equipment these days, using the internet, using the computer to keep up to date with what's going on around them. Not to mention that most senior citizens at their age probably are dealing with a health condition or are taking a medication or multiple medications. So I'm sure they have concerns. It turns out in our classes they do have a lot of concerns. So
Right.
their questions get to answer.
This is what I see.
Answered.
This is what I see at my senior center.
Yes.
I see a lot of people with diabetes. They watch their sugar count and everything. Even where I sit at my table, out of 8 people, I would say 5 of them are diabetic.
Yes.
Then I see a lot that have prostate cancer. Prostate, I happen to be one of them. Then there's some in there that have Alzheimer's.
Yes.
Some that have Parkinson's.
Yes.
And I'm trying to, and some have not only Parkinson's. Is that what, when we had a lady,
Dementia?
dementia, yeah.
Dementia.
And there was another one that slurred, that had a stroke, I guess.
Stroke.
And she couldn't talk straight for quite a while. And they go to rehab.
Yes.
Do you have something to do with that too, Mrs. Sun?
Yes, the A.R.C.H website actually provides all kinds of health information that can help people understand better what they are living with, like all the conditions that you just mentioned. So it's certainly helpful. It goes back to the old saying that knowledge is power. It is power, knowledge. Once people learn more and they understand more, so the logical conclusion here is that we hope people will do better based on their knowledge, and so they will take better actions, including working better with their doctors and nurses as a team, because these days patients are really part of the healthcare. They are actually the center of this healthcare, so patients need to take the initiative. So A.R.C.H program is really here to help all our patients to reach this goal, especially senior citizens, because A.R.C.H program does have a senior service focus here.
Right, I see the A.R.C.H program was established in 2000, so it must have been established by you since it's 13 years ago that it was established. So were you probably one of the ones that established it, if I may ask?
Yes, I'm actually a very proud member of a team at MGH Community Health Associates, MGH Center for Community Health Improvement, that actually established the A.R.C.H program in the year 2000. So A.R.C.H has been very active serving needs for health education in the communities since then. And we have been receiving grant support continuously from the National Library of Medicine New England region. Actually, we received another grant recently. That grant is going to go to Charlestown JFK Family Service Center. That also includes senior citizens there.
That's
So,
good.
Yeah.
You're also, MGH is also in partnership with the Treadwell Library?
Yes.
Could you tell us about that?
Yes. MGH Treadwell Library is our own hospital's library. It is actually the biggest medical library in New England region, hospital-based library.
Where is that located?
It is located in our main campus, right next to the main MGH building.
In Boston?
In Boston, yes. The Red Line T goes there, it stops there, MGH. And the Blue Line also goes there.
The Red Line stops right there too.
Yes, and the Blue Line also stops at Bowdoin, but then you need to take a little short walk down Cambridge Street to get to Mass General. So Treadwell is right in that area. If you ask the Mass General information desk at the front, so they will be able to show you where Treadwell Library is.
And is that open for the community if they want to go, like if I want to go in there and look up something, I can do that? Or is it just
Patients are welcome to go into Treadwell Library to look up journals, magazines, and then we have something actually specifically for patients at Mass General main campus that's called Blum Patient and Family Learning Center, which is also located at a very central location inside the hospital building. Once again, if patients from Revere communities and other communities go to Mass General, they can ask the front desk where the Patient and Family Learning Center is. They will be able to show them. So they have also computers and staff there to help patients to get to health information and resources. So we have not just Treadwell Library, but we also have the Blum Center there for patients. Yeah.
Now, before we get back to this, I'd like to ask you a personal question.
Yes.
Tell us, when you were a little girl, how this education and how you first got very much interested in this. I mean, you just didn't come out of the woodwork with it.
When I was a little girl, I was actually in China. So
how in China? What
Yes.
part of China?
Southwest.
The name of the city or town?
Sichuan province, Chongqing. The city of Chongqing is my hometown city. It's actually the city where if tourists going to China who want to take the boat trip down the stream to the Yangtze River, which is the second longest river in the world, I believe.
Is that the Yangtze?
Yeah, the Yangtze, either the first or the second longest. People need to take the boat trip down the stream to see the beautiful scenery. Chongqing is actually the starting place to take the boat trip.
Now I'm going to ask you what some people will ask you. The education that you get in China as compared to the education that we have here in the United States, would you say we are better or equal?
I think we're different. I was educated through kindergarten all the way through graduate school in China, actually. I already finished graduate school in China, but when I came to the United States
When
more
was
than
this?
20 years ago.
Oh, 20 years ago?
Yeah, 20 years ago. I actually changed my major. So I studied public health here. So I went back to graduate school here to study public health and also health education. I guess that explains why I become a health educator here.
I could see that.
Yeah.
Right? You know, Revere is made up of a lot of people. We've had people from Ireland up here, people from Egypt up here,
Yes.
people from Russia up here, and now we have a person from China. So thank you for coming to the United States. We're proud to have you here.
Oh, thank you.
And the
Thank
city
you.
of Revere is
Yeah.
proud to have you.
Yeah.
Okay. Over here it says, oh, by the way, mentioning Lois Diamond, she is in the hospital, and she had a knee operation. So Lois out there, we and Mrs. Sun, hope you get well, and I'm sure everybody at our senior center
We
does.
miss you, Lois.
Right, and God bless you, Lois. Take care of yourself. Okay, now
That's
back
so
to
sweet.
right. The service is strictly for seniors now. It says, what service does A.R.C.H. I still don't know what it stands for.
Okay, I'm going to say that again.
Provide for senior citizens.
Yes. A.R.C.H stands for, once again, Access to Resources for Community Health. I know it sounds like a very broad term, but actually A.R.C.H focuses on providing access to electronic health education information, meaning a website. So A.R.C.H can specifically give senior citizens a training based on that they already have the basic computer skills. That's why Lois's work at Revere Senior Center is so important and helpful, because she does the ground work to train the seniors for them to be able to have the computer skills. And then they can take advantage of the A.R.C.H website. So that's what A.R.C.H can do for the senior citizens. And also for any seniors who are not interested in taking any computer class to do the A.R.C.H website, that's fine too, because I'm here. So I'm here to help them. Those seniors, they can always call me. Once again, my phone number is 781-485-6477. They can call me and say, Ming, I have a question about this condition or about this medication or about this procedure I'm going to do. Can you find some information so I can read ahead of time so I get better prepared for this procedure or taking this medication or living with this, say, for example, maybe it's a newly diagnosed disease that a senior citizen just has. So I'm here to help those who do not want to use computers, so they can always call me or email me. A.R.C.H also has an email box, which is at A.R.C.H, that is A.R.C.H, at partners.org. So
Right.
people can email me too.
Mrs. Sun, you wrote a nice article here, and instead of me reading it, I would like you to take the honor to read it because you're the one that wrote it. That would be number 4 down here. Would you read that out loud for the people? I want them to know, because if you are a senior and you're 60 years old or plus, please come down to our senior center and she'll tell you the reason why.
Yes. Okay. Number 4, you said.
Yes.
So number 4 says, what services does A.R.C.H provide for senior citizens? So it says the A.R.C.H hands-on training is regularly offered at Revere Elder Affairs, thanks to their long-time interest and collaboration work with Lois Diamond, who teaches a 5-week basic computer course to seniors. The 5th week of this course is for A.R.C.H hands-on training. This course is very much in demand, as Lois always has a wait list of seniors who are very interested in taking this computer course.
Right, and if they are interested in taking this computer course, they can come down to the Revere Senior Center,
Yes.
which is located at 25 Winthrop Avenue, Revere. Or they
Correct.
can call the Revere Senior Center, 781-286-8156.
Yes.
Now I got to ask you, what would you like to see your organization do in the future, or your future plans?
Oh, that's an excellent question. I would love to comment on that. I was going to say I brought a focus of the A.R.C.H program here to today's show, but I was going to share with everyone in Revere and beyond that MGH community health centers, including MGH Revere, do so much for our patients and the communities in large. And currently we are working on several initiatives. Many of them are about healthy living in the communities. So we have Revere on the Move here, and we also have Revere Healthcare Center. Dr. Amy Wheeler is leading Revere Healthy Living Collaborative with people in my office. So I believe the team is going to come here or is going to produce health education shows, including nutrition, exercise, and stress reduction, and other concerns people may have when it comes to healthy living. So we are going to be able to regularly produce those shows and then share them with the community through the cable TV service here that gets people connected. So we will be able to do that very soon.
I got to say one thing to you. My wife had a heart attack. She was at the Mass General on Broadway a few years ago. There was a Dr. Chu, maybe you know him, Dr. Chu?
Yes, I have heard of his name.
Right. Well, he rushed her in an ambulance to the Mass General Hospital in Boston. And if it wasn't for them, I'd be a widower. But they did a beautiful job.
I'm glad it's a happy ending.
It was a very happy ending. They took excellent care of her. So the Mass General is one of the best. They say it's the best hospital in the country. I think it's the best hospital in the world when it comes to people.
Oh, thank you, thank you. Yeah, we're very proud here working for this hospital community that serves so many patients beyond this region and definitely in the communities. Just based on the number of healthcare centers that we have in the communities and also the satellite health centers that we have in some of the schools, such as Revere High School has an MGH-operated school-based health center just serving high school students there. And Chelsea also has a school-based health center at Chelsea High School. Right,
and I'd like to ask you, could you tell the people on TV where the Mass General are located? I know they have one in Revere. The other towns, I think they have one in Everett, if you know where they're located on Mass General. And
yes.
They do have one in Everett?
Yes. Yeah.
Any place else?
Yeah, I can tell people that information.
Please do.
So our MGH Revere Health Center is located on 300 Ocean Ave here in Revere. So we are oceanfront. And the Revere Health Center also has a satellite site right here on Broadway. I believe they are about or is already in the middle of moving to this facility here on this side of the street because they used to be over where the post office is. So we have a separate practice there. So that's for Revere, and also the Revere School-Based Health Center I just mentioned. And there is also a Revere Adolescent Health Center, which is also located inside the post office building. So that's for walk-in services of children, adolescents who want to see a nurse practitioner for their health needs. We also have a health center in Chelsea, which is at 151 Everett Ave. And also across the street, there is a satellite practice there that belongs to Chelsea MGH Chelsea Healthcare Center. And then Chelsea High School, like I just mentioned, has the school-based health center. And then Chelsea Roca also has an MGH-operated adolescent health center that's located on Park Street in Chelsea. And then Charlestown is, there's MGH Charlestown located at 73 High Street. And MGH Everett is located on 19 Norwood Street, Everett. So we have all these health centers as an expanded service out of Mass General in town. So we do a lot to cover so many communities.
Right. You're going to have to forgive me. We got a couple of minutes left, so why don't you take a minute and wrap it up and say what you'd like. Anything you want.
Yes, absolutely. I'm actually really happy today for this opportunity for me to come here to showcase a little bit of what I do as a health educator with MGH Community Health Associates. We are under MGH Center for Community Health Improvement. And A.R.C.H is only part of what we do at MGH Community Health Associates and Center for Community Health Improvement and MGH Healthcare Centers. I'd like to thank Morris and the camera crew here for me to have this opportunity to come here and talk about A.R.C.H. And we also, I would like to have more opportunities down the way that we can come here and share with people more of what we do out of Mass General.
Mrs. Sun, I want to say it was an honor to have you come here, explain what you do, explain what MGH do, because I learned a little too.
Thank
so I
you,
want to
Morris.
thank you for coming here. And I want to wish Lois Diamond again. I hope you get well, Lois. And I want to thank the people of Revere for listening. God bless our troops. God bless the United States of America. Until the next time out there, thank you for listening.